For this patient, I'm going to measure lumbar flexion and then trunk side lateral flexion. For lumbar flexion, I'm going to first palpate his PSIS and make a mark between them at S2. And then I'm going to take the tape measure and I'm going to measure 15 centimeters superior to that and make a mark. Made a mark there. And next I'm going to have the patient bend forward as far as he can. And I'm going to take a measurement between those two marks, so go ahead and flex forward. Again, we have 15 centimeters difference that we started with, and we're going to get a greater distance when we measure this. And I got 21.5, which is a 6.5 centimeters difference there. 6 centimeters being just the normal amount of lumbar flexion, so he has just a little bit more than normal, which is okay. For his side trunk lateral flexion, I have to mark S2 again, and then I'm going to mark his C7 spot up there. And to mark C7, I'm going to have him flex his head forward, and you can find the bony prominence there and make a mark. And go ahead and relax. And then using a goniometer, I'm going to use the axis, or mark the axis, here at S2. The stationary arm is going to point down and be perpendicular to the floor. The movable arm will be lined up at C7. So I'm going to have the patient flex down to his right. So go ahead and start flexing to your right. And line up the movable arm again at C7. And it looks like he has about 34 degrees of lateral side flexion to the right, 25 being normal, so he has a little more flexion to the right. Okay. Then I'll have the patient flex to his left as far as he can. Again, my axis is at S2. My movable arm is at C7. And there we get a reading of 35 degrees. So he has just one more degree of lateral flexion to the left. Again, 25 is normal.